Carpal tunnel syndrome often presents with symptoms of numbness and tingling. What will usually bring patients into our office, though, is an inability to sleep at night because their hands hurt and that they wake up during the night. The inability to get restful sleep, as well as the numbness that they experience doing normal things during the day, driving a car, holding a cup of coffee, reading a newspaper, interferes with their ability to have a normal life. Those are the sort of problems that generally bring them in. Treating carpal tunnel syndrome is rather straightforward. It's the most common neuropathy of the upper extremity. It's common in the population among all sorts of people. It can result from problems related to how you work as well as other things you do in your off time. Treating it is straightforward, and most patients are treated without surgery. They wear splints at night, we provide steroid injections, and if those sort of measures fail, carpal tunnel release is actually a relatively straightforward surgery. Traditionally, carpal tunnel release was performed with an incision in the palm of the hand. The majority of the time now I can actually do it from the inside out in a minimally invasive manner, utilizing a camera in a procedure that's called endoscopic carpal tunnel release. That procedure takes minutes in some cases and generally can be done as an outpatient. There's limited downtime after surgery. So if you are experiencing symptoms of carpal tunnel syndrome, numbness, tingling, or hand pain, contact our office. We'll set you up with one of our specialists to determine an individualized treatment plan that works best for you.